When we were at the hospital, what had happened was that the previous group was basically having great issues with competency as well as with providing a range of anesthesia services that were necessary for the surgeons and for the patients at that facility. So when we came in, we basically were addressing those issues about anesthesia safety, anesthesia competency, as well as providing the adequate coverage and range of services that were needed for that facility. One of the greatest challenges was that we had a very short time window of notification for going into that facility, and we basically had 3 weeks in which we could provide staff for this hospital. So one of the big challenges was being able to rev up quickly, which we were able to do by both providing anesthesia providers from both FOAA in general, as well as selecting specific providers from the previous group that we deemed to be competent to do anesthesia at that facility. So initially, it was the short startup time was a big issue. Then after that, it was basically hiring a stable staff that were competent and that were able to do the work at that facility overall, and restoring confidence from the surgeons and from the hospital and the patients as well. Well, one was to screen the providers in general and have a discussion with the hospital as well as with the surgeons about who the providers were, targeting specific anesthesia providers that were competent for that facility. After that was basically creating confidence and stability in the group overall by providing good care, by providing the range of services and trying to understand what the needs were for the department as well as for the hospital as a whole. Well, after having been there for several years, the department is very stable. We've received great PRC scores overall. The scores have gone from basically the basement to basically a 5-star score, so that means they're in the 99th percentile. So the department overall has excelled. We have had a very stable staff there in general. There's been very little turnover in terms of anesthesia providers, both nurses and docs, which to me is a symbol that basically that they're very happy to be there. And overall, we've increased the range of services that were provided. We've instituted a regional anesthesia program there. We've expanded our services to both radiology, cardiology, as well as endoscopy as well. So we've kind of expanded the broad range outside of the operating room of things we could provide. I think the future is bright for that hospital. They're starting to expand, and as the hospital expands, we're going to expand as well in terms of the department and what we can provide for them. We are starting to focus on other aspects of the department as well, such as compliance, such as quality improvement measures as well. And overall, we're going to try to increase the range of services that we're providing, as well as sort of the depth of those services.